Hi, my name's Nicole. I'm going to be your nurse practitioner today, doing your head, eyes, ears, nose, and throat exam. So we're going to start with some hand washing, and then I'm going to get right to it. So looking at your head, the skin is pink, and I'm not observing any lesions, lumps, or nevi. And so next I'm going to palpate your head for any tenderness, lumps, or lesions, looking at the hair distribution, checking for any lice or dryness of the skin. Everything looks good there. So next I'm going to go to your temporal mandibular joint, just again inspecting, making sure there isn't any redness or swelling, and I don't see any. So next I'm going to have the patient, I'm going to have you open your mouth. Perfect. I'm just going to go ahead and close it. Just going to press lightly just to make sure there isn't any popping or clicking when he closes his mouth. And there's not. And then next is the neck. So looking at the neck, it's erect. Not noticing anything on the skin, any lumps or lesions or nevi, and the trachea is midline. And then next I'm going to have you extend your head up towards the ceiling a little bit, and I'm going to palpate the thyroid. So I'm not outwardly noticing any goiter, but I'm going to have you swallow for me. Perfect. So I can feel that the thyroid is rising and falling appropriately at midline. And then next I'm going to have you put your head down just a little bit for me, and I'm just going to inspect and manipulate the C-spine process, making sure there isn't any tenderness or deformities or lumps. And there's not. So next we'll do some range of motion on your cervical spine. So I'm going to have you put your head to the ceiling, or look up at the ceiling, look down to the floor, look back up and look to the left, then look to the right, and then ear to shoulder, whichever one, and then the opposite. Okay, so patient has full range of motion of his cervical spine. So next we'll get to the eyes. So we'll start by checking cranial nerve number 2, which is the optic visual acuity, the optic nerve 2 visual acuity. So cover your right eye for me and read the smallest line you can read.
LTFFH.
Perfect. And then with the other eye as well.
LTFFH.
Okay, perfect. And then I'm going to get real close to you, and we're going to check your, this is called the wiggle test, where we check your visual fields.
Okay.
So let me know when you can see my hands.
Yep.
And then I'm going to tell me which side is wiggling.
Left.
Perfect. And then again this way.
Yep. Bottom.
Okay, good. All 6 cardinals, oh, wrong thing. So your visual field is normal, your peripheral vision. You have good peripheral vision. So optic cranial nerve number 2 is intact. So next we're going to, I'm going to have you take your glasses off.
Okay.
And I can put them over here. And I'm just going to inspect the eyes. So looking at the eyelids, the eyelashes, I'm not seeing any lumps or lesions. I'm not seeing any drainage in the lacrimal apparatus. I'm going to pull your lower lids down, and I'm going to have you look from side to side and up and down. And I'm observing the conjunctiva and the sclera, and the conjunctiva is pink and moist as it should be, and the sclera is clear. So next I'm going to get my little light here, and I'm going to shine oblique lighting on the side, and I'm looking at the cornea and the lens for any opacities, which I'm not seeing. Good. And then I'm also going to look at the iris as well, looking for any narrowing of the anterior chamber. Okay, good. So next we're going to check your 6 cardinal fields of vision. So actually I'm going to use the pen here. So I'm going to have you follow my pen with your eyes.
Okay.
And we're going to check all your fields. So I'm just looking for lid lag, nystagmus, or just use your eyes, not your head. Or any conjugate gaze. So let's do it one more time. I guess I shouldn't have you have your glasses on when we do this, because you do use your glasses. Okay. And then I'm going to have you follow the pen. So looking for convergence, which he is doing appropriately. So next I'm going to dim the lights, and I'm going to focus on the patient's red reflex. Okay, which is noted. Perfect. And then I'm going to move in really close, and I'm going to look at the patient's optic disc and the physiologic cup, looking for color, and then I'm going to have you look straight at me so I can. Okay, good. So there's no AV nicking, no exudates, no hemorrhages. I'm looking at the fovea and the macula, and no papillal edema. Okay, so the next thing I'm going to do, here, give me your glasses back.
Thank you.
Okay, so the next thing we're going to do is the ears. So inspecting the ears, they are symmetrical. I'm not seeing any lumps or lesions around them. I'm going to palpate the tragus and the mastoid, making sure there isn't any tenderness. Then I'm just, on this side, I'm going to be turning your head that way for me. Okay, so I'm just observing the external auditory canal. There's no drainage. And then I'm going to insert my thing here, and I'm going to look at your tympanic membrane, which is pearly gray as it should be. I'm not seeing any exudate or erythema or edema inside the ear, and all of the bony landmarks are visible. And then, so the next thing I'm going to do is the whisper test. So I'm going to go behind you, and I'm going to include one ear, and I'm going to have you repeat what I'm saying.
Apple.
Okay, and then I'm going to do this ear.
Baseball.
Perfect. So he's able to hear with the whisper test, but if he wasn't, we would go to the Weber test, which is looking for lateralization. So I'm just going to strike my tuning fork here, and I'm going to put it on the crown of your head. Can you feel that? Can you hear that, I should say?
No.
Okay, let me do it again.
Yes.
Okay, and so we're looking to see if it lateralizes to one ear or the other, and if it does, the ear that it would lateralize to would be the one that we would be concerned with. And then we would go to the Rhine test, which again, I'm going to strike my tuning fork, and I'm going to put it on his mastoid bone, and then see if he can hear that.
Yes.
Okay, tell me when you can't hear it anymore.
No.
Okay, and then I'm putting it directly next to his ear. Can you still hear it?
Yes.
Perfect. And the goal is that the air conduction is greater than bone conduction. Good. Okay. So next we're going to go to the nose. So the nose is symmetrical, not noticing any lumps or lesions. The ala is intact right here. I'll palpate carefully around his glasses. Any tenderness?
No.
Good, and then while I'm doing this, I'm going to palpate your frontal sinuses. Any pain?
No.
Good. So I'm just going to look inside of his nose, and I'm really observing the mucosal membranes, making sure they're pink and moist, looking at the inferior turbinate, and looking at his septum, which is not deviated, it's midline. So next, and then we want to check for patency. So I'm going to have you cover the right side of your nose and take a deep breath in. Perfect, and then do that with the other side. Good. So he's got full patency on both sides, both nares. So the next thing I'm going to do is look inside the mouth and outside the mouth. So looking at his lips, they're pink and moist. There's no cracking. There's no hepatic lesions. So next I'm going to have him open his mouth and say ah.
Ah.
Okay. So his uvula rises appropriately at midline. There's no deviation. Okay, so next I don't need you to make any noise. I just need you to open your mouth for me. So I'm looking at all the mucosa. I'm looking at the buccal mucosa, and I'm looking for any ulcers, any lesions, underneath the tongue for any euplasia. I'm looking at his dentition, which is good. All teeth are intact. Looking at his hard palate, his soft palate, and stick your tongue out for me one more time, like just out. Yeah. So looking at his tonsils, which are bilaterally equal. The pharynx is a normal pinkish color. It's not red, swollen, or any exudate. And then I'll have you stick, and then the ah is the cranial nerve number 9, where we, so that is intact, and then cranial number 10, nerve number 10 is the, hypoglossal nerve, and I'm gonna have you stick your tongue out. Okay, so it's symmetrical, it's midline, and then I'm gonna have you do that from side to side. Okay, so there's no deviation or flaccidness that he can't do. Okay, and this concludes our head, ears, eyes, nose, and throat.
Thank you.
Thank you.